Hi guys, do you know what's first aid? Do you mean by this box? Well, first aid is more than just this box. First aid is an immediate treatment or assistance given to someone who is injured or suddenly taken ill before the arrival of ambulance, doctor, or someone who is appropriately qualified person called first aider, such as EMT, policeman, paramedics, or even firemen. Oh, sugar! The aims of first aid are to limit the worsening of the condition, to promote health, and to preserve life. Becoming a first aider is not easy nor hard. All you have to remember is three things. The first one is protect the casualty. Try to avoid from cross-infection when doing first aid. If possible, avoid from contacting with body fluid of the patient. Secondly, wash your hands, or you may use your hand sanitizer or even alcohol so that you will kill all the bacteria in your hand. Thirdly, wear gloves. If the gloves are unavailable, the treatment should be given to. Secondly, you should be responsible as a first aider. And lastly, you need to give care with confidence. Stay calm and be serious and be logically. Speak with a language that the patient can easily understand. What happens if someone around you got a cardiac arrest? What should you do? We will explain later about the first aid on someone who has cardiac arrest. But before that, my friend is going to explain to you the main steps of emergency action. Adam?
Alright, thank you for the introduction. So now, I will proceed about the 4 main steps of emergency. So the first is the assess. Second is the make a safe. Third is give emergency aid. And the last but not least is to get help from the surrounding you. So for the first thing is the assess. The approach will be brief, but you need a calm and controlling and use your calm and confident voice. The next is use your eyes and ears to be aware of the casualty response. And the last is listen and make eye contact, but please do not stare at them. So for the next point is to make the area safe is the first thing first is please put your own safety first and do not attempt to do too much and do not show your arrow, and please be aware of your limitations and remove the danger from the casualty if it is possible to you, but if it is not, please just wait from the someone better. So for the third point is to give the emergency aids, such as make initial assessment of the casualty, establishing where the casualty lies to make sure it is still conscious, has an open airways, is breathing or not, and still have a pulse or not. While doing that, you can ask some favorite question or talk about something as well, hold the hand and hold the shoulder. And last but not least, always stay with the casualty as long as ambulance still not arrive. So the final point is to get the help. So how? So what you can do? As you have many ways to help them, such as you can make the area safe, you can call your assistant, you can first aid equipment, you can control traffic and onlookers, you can control bleeding and line, transport the casualty to a safe place or some better place. You have so many ways, so no reason to you not to help them. And that's all from me about the 4 main steps of emergency. So now I will pass to Nisha to explain about the technique.
Today I would be explaining about the CPR techniques for a person who collapsed due to cardiac arrest. What is CPR? CPR stands for cardiopulmonary resuscitation. Cardiac arrest is the sudden loss of blood flow resulting from the failure of the heart to pump efficiently. Symptom of cardiac arrest is dizziness, irregular heartbeat, wheezing, chest pain, and heart palpitations.
What happens if someone suddenly goes into cardiac arrest?
Hey, where are you from?
I went out with my friend.
Can you see what time is it now?
3 a.m. So,
You're so sorry.
you're no fun, mommy. From now on, I'm not your daughter anymore.
And what if someone just came back from a vigorous activity at night and got cardiac arrest?
These are the steps on how CPR is performed on a person collapses with possible cardiac arrest. Step 1. The person is brought to a safe and clean place. This is to ensure the person's safety. Step 2. Call 999 active emergency response, which is the ambulance. Step 3. Check for response. Assess for pulse and breathing. Look, listen, and feel.
Hello, I'm Sarah. Can you hear me? Can you open your eyes? I'm touching your shoulder. Can you feel me?
Start CPR. What is CPR? CPR is cardiopulmonary resuscitation. It is an emergency procedure combination of artificial ventilation and chest compression.
Before performing CPR, please wear gloves. If you are not wearing gloves, sanitize your hands with hand sanitizer before performing the CPR.
Step number 5. Give 30 compression at the rate of 120 per minute.
Make sure that you put your hands together like this. Your right hand below your left hand. And make sure that your arms and shoulders are straight.
Place both on the person's breastbone in the middle of his or her chest.
You can do the compression according to the beat of the song Staying Alive.
Step number 6. Opening the airway by lifting up the chin and tilting back the forehead. Number 7. Keep doing CPR until an AED is brought. Relax and repeat. Keep doing CPR until someone arrives with an AED. CPR is an effective method to save life, especially those who suddenly collapse due to cardiac arrest. Performing CPR on a person who suddenly collapsed due to cardiac arrest helps to pump blood throughout the body. This helps to send oxygen to the brain and all parts of body. Performing CPR on a person who suddenly collapsed due to cardiac arrest doubles the chance of survival.